Conscious bites. Milk to solids. Part 11.
What should I do if I suspect a food allergy?
It depends on the symptoms. If the symptoms are immediate, then it's thought to be an IgE-mediated food allergy, which means the allergic reaction is triggered by an antibody called immunoglobulin E, or IgE. These antibodies are the chemical signals that set off an acute allergic reaction within a few minutes of eating the food. The common symptoms are a flushed face, hives, swelling of the lip, eyes, face or throat, or a red and itchy rash around the mouth, tongue, eyes and body. A rare but more serious reaction is anaphylaxis. This is when there is a sudden development of wheezy, cough, shortness of breath or difficulty noisy breathing. Anaphylaxis is a medical emergency and needs immediate treatment because in a small number of cases it can be fatal. If the symptoms are immediate, then you avoid the suspected food until you visit your doctor. The delayed reactions are known as non-IgE mediated food allergies. This type of allergy is not caused by IgE antibodies. It is usually because of cell reactions in the immune system. Non-IgE mediated reactions often appear several hours or days after the food is eaten and can cause symptoms over a longer period of time, such as eczema, diarrhea, constipation, and in more severe cases, growth problems. For delayed symptoms such as eczema or reflux, it's best to keep a food diary. On the food diary, try to record all the meals eaten by your baby during the course of the day, including snacks, drinks and milk. If your baby develops eczema or reflux before 6 months and is breastfed, then it's best to record what the mother is eating. If you suspect a possible food allergy, then it is also a good idea to keep a diary of the symptoms developed, where you were as a possible trigger, and did you give any antihistamines. Take the food diaries with you when you visit the doctor to establish a relationship between the food and the symptoms. When you visit the doctors, be prepared that there will be full medical history, physical examination, and possibly allergy tests. There are 4 types of allergy tests for IgE-mediated food allergies: a skin prick test, a blood test, a patch test, and a challenge test. The skin prick test is the most common test available in hospitals and requires trained medical staff. After the full history of possible triggers and symptoms, some allergens will be identified. A small drop of the allergen in liquid form will be introduced to the skin. Each drop of liquid is then pricked with a tiny needle which punches just the top layer of the skin. After around 15 to 20 minutes, the nurse will then check what reaction has happened on the skin. A RAS test. A specific IgE blood test, or previously called RAS test, works by testing a small blood sample in the laboratory to measure the amount of IgE antibodies produced when contact is made to the specific allergen. If you suffer from contact eczema or other type of skin reactions, the patch test would be the most suitable to find the cause of the allergy. The suspected allergens are placed on a metal disc or strip, which is then taped to the patient's back and left in place for 48 hours. The test strip is then removed and the doctor or nurse will examine the area to see if there was a reaction. The challenge test is when you give the child the suspected food allergen and then monitor their reactions. As this could result in a severe allergic reaction, it must only be performed in hospital with qualified medical staff and equipment. With delayed allergies, exclusion diets may help identify the allergenic food. It is when the suspected food is completely taken out of the diet with the help of an allergy dietitian. If the food is then the cause of the allergy, then the symptoms should improve when the food is avoided. After a period of exclusion, the allergen will then be reintroduced in small amounts. If the symptoms return, then it will be identified as the allergen causing the allergic reaction. Some children can have an IgE-mediated food allergy, but the symptoms are not IgE-mediated. And some children can also have a mixture of IgE and non-IgE-mediated food allergies, so it's not always so clear-cut. Alternative tests for food allergies are offered by some complementary or alternative health practitioners. Your health professional will not provide tests called applied kinesiology, hair analysis, Vega tests, and serum-specific IgG antibody tests, as there is no evidence that they can reliably diagnose food allergy.
Will a dietitian help me through this?
Of course, allergies don't just affect the child, it actually has an impact on the whole family. There is a lot to consider, such as food shopping, eating out, travelling, family events, parties and invites, school trips. And some may also need to carry antihistamines or EpiPens in case a reaction occurs.
Gosh, is it for life? Do children grow out of the food allergies?
Some food allergies, such as egg and cow's milk protein, are sometimes outgrown during childhood. However, allergies to peanuts, nuts, fish and shellfish tend not to go away. Children with food allergies also have a high chance of having other allergic problems such as asthma, eczema and hay fever.
Are there any treatments?
Fortunately, we have some foods to replace the allergenic foods which are available on the free-form range in supermarkets. And we also have the hyperallergenic formula for cow's milk protein allergy, which can be prescribed by your doctor. Your child will need routine appointments at the hospital, and the allergy test will be repeated to see if your child has outgrown the allergy. For children with multiple food allergies, it is important that they see the dietitian to ensure that they are not missing any nutrients in their diet.
Do food allergies cause eczema?
Hi, I'm Miss Dietitian from Conscious Bites. Hope you enjoyed this episode. Please leave comments below and don't forget to subscribe. Follow us on Facebook, Instagram and Twitter. For more information, you can email us or check out our website. Bye!